Okay. Good evening, everyone. Thanks for joining me this evening. So this session is about GeroCare. I just want to share some information about this service, which I think will be of value to you. Um, I have a quick outline to go through. So just a short information about myself, the problem and the gap that has been identified, the current solutions of what people do to try to solve that, what GeroCare does, and I'll go through a demo of the website. So my name is Dr. Tobi Kupului. I migrated with my family to Australia in 2013, first in New South Wales and now in Victoria. I finished my GP training in 2022, and I became a GeroCare sponsor in 2023. So was looking for some type of service for my mom. As a family we were. So that's the first time I got to know about GeroCare, and I was appointed the country director last year. Um, Again, I just mentioned this to say that all of this can be verified online. My profile is on GeroCare's Facebook page as well. So just going through the health problems currently. So this is as per WHO data in 2021 that the life expectancy for an average Nigerian is 63 years, which means the average number of years for a person born in Nigeria expected to live. And then out of those 63 years, 55 years, average number of years without any health challenge. So it means that, beyond that age range, even whether or not you're aware of it, there's a likelihood that you have one health challenge or another, or at risk of having one. And also, there's the issue of distance. So, mostly for economic reasons, people leave from one state to the other for family or for marriage or whatever reason they leave where their parents are. And particularly for, with immigration these days, people are leaving the country to different parts of the world. So most often than not, our parents are back in Nigeria, and it just creates that gap where you don't know how much how well they're doing, and they might have one or two health challenges you're not aware of. So um how do we so before I go on to that, again, this is another slide that sort of summarizes that point, which is that by or before the age of 40 years, about 75 people will have lost either one or both parents, or at least one of them will have, severe medical condition. Again, just to reiterate the fact that at that age, you would expect that, there will be one health challenge or another. Now, currently, what we do, at least I can say this for my family, and this will be applicable to most of you as well, that sometimes we rely on our parents to look after themselves. But again, how reliable is that? You call them and they say, oh, everything is fine, but everything is not really not fine because they don't want to bother you. And some things don't have any symptoms, they just creep up on you and you don't know until it's too late. Other times we rely on family and friends. Again, if some of them are still back in Nigeria, or all your siblings might be out of the country already as well. So again, how much reliable can that be? In some families, you give money to somebody and they redirect the funds to something else that is more pressing. So again, that's not really reliable. You might, get your parents to private hospitals in Nigeria. Again, depending on the kind of private hospital it is, the cost might be prohibitive. You have to pay a card fee. And then particularly you don't have, as the carer or the child, you don't have any access to the records, or what happened during those appointments. And again, you can't really rely on what they tell you. Sometimes they don't remember the exact things that the conversation was about. In the public hospital system, um, maybe cheaper than private hospital, but again, you have challenge of waiting time. It's a crowded place. Again, you don't have access to the record of information of what happened. Medical tourism is a common option, but again, that is cost prohibitive. You have to think about the visa It's time consuming. And how often can you really bring your parents out of the country for a general checkup? So these are the gaps, or these are the solutions that were, quite imperfect that, we use to look after our parents. And I think GeroCare closes the gap on all of those things. So as a summary, GeroCare makes it possible for Nigerians. And again, this is whether, they're at home or they're abroad, it doesn't matter where the family member is again. So the child or the carer is, it's applicable to everyone. And the beneficiary is the elderly person that is at home in Nigeria, um, regardless of what part of the country they are. Um, so Jericho does that through established network of doctors and partners across the country. And then you have access to all of that through the Jericho application. Now, so GeroCare has been in existence since 2017. Again, I only got to know about them in 2023, but you can tell that they've survived COVID, which I think speaks of a well-organized company. And these are the partnership that they have um, across the country. So, from corporate organizations to pharmacies and labs. And this is an example of an international presence that they have. Now, so how does it work? Just a summary of how the process works. So you are the sponsor. You are nominating your parents as beneficiary. So you go to the website, you sign up, and you add the beneficiary. Now, the beneficiary can be your parents, your in-laws, your grandparents, your uncle, your aunt. It doesn't really matter. You make a payment after you select what type of subscription that you want. Um, Generally speaking, after you register, the client services team will reach out to you as well, just to, take you through what needs to be done. After you put in your beneficiary, you put in their details and their address, and they are matched with the doctor in that area. Okay, so it doesn't matter what part of the country it is, they match with a doctor that is also or has been onboarded on the GeroCare platform. So they schedule a regular visit within 72 hours after you subscribe. And then what happens is that you get a report of that visit on the platform. So you know exactly what happened. You know when the doctor came in, when they went out, the record of the visit, and you can tell what the next steps are based on that. So during a doctor visit, what happens is that again the doctor checks in, a notification is sent to you, and then after the doctor leaves, they check out. And you receive the reports of the health status and what the recommendations are. Now, so you might have a recommendation to do some blood tests or to buy some medications. That is also listed in the report. What then happens is that the client services then raises an invoice for those additional services. They present it to you. After you pay, GeroCare then provides the logistics to either send someone to the house to take the samples, or if they need to be taken to another facility, GeroCare organizes the transport for them to be picked up to the lab or to the scan place or whatever, and then drop them back home. For medications as well, again, the client services raises an invoice for the medications listed. After you pay, the GeroCare then organizes for the medications to be bought in the pharmacies around the area and then dropped off at home. So essentially, it's a hands-off thing. You can do this from wherever you are in the world, and GeroCare does everything else on your behalf. I just want to mention that you don't have to rely on GeroCare to do the buying of the medication or organizing the investigations. You can do that yourself, but it sort of defeats the purpose. And one thing I tried when I was doing this for my mom was I actually called the labs myself to get the pricing, and GeroCare's pricing came to be cheaper. And the reason is because GeroCare has organized corporate discounts, and sort of that makes sense with the volume or potential volume that is expected. The lab can offer discount at the corporate level. So again, it becomes overall cheaper for GeroCare to do it than for you to do it. From a medication perspective, there are pharmacy aggregators that sort of compare pricing in local labs, and then pick the right choice in terms of what's cost effective. Again, you are here in Australia or wherever else, you don't know, it could be it could have been out of the country for 5-10 years. You don't really know as much as to what's on ground, but Jerry can do all that for you. You just have to pay for the service and then it gets done. So what are the benefits to you as the sponsor? So again, it's peace of mind. So you're here, your parents are somewhere in Nigeria. You don't want to rely on third party. You don't know exactly what's happening. But with GeroCare, you have that peace of mind that they are doing well health-wise. And then you get real-time updates, like I mentioned before, on your parents' health status. You have the access to the medical records. So on GeroCare platform, that's quite portable. So again, because everything gets sent on that platform, you have access to it. Now, in my case, one of the advantages that I didn't, I wasn't aware of prior to joining GeroCare was that between the time we registered our parents and now, they've had to apply for a visa. And if you've gone through that process before your parents, you realize that they will require medical records. And, prior to this time, you have to call this hospital or call that hospital or whatever, without having everything in one place or knowing exactly, what to present. But with this, it was just a click away, a couple of clicks away. I was able to download all that information as part of their visa application. So, just an advantage that was not, thought of beforehand. Um, Now, affordable. Well, that's relative because if you zero in on just the dollar amount, um, you know, it's probably better to think about it from the value aspect. The value that you get from this service is not comparable to the cost. Um, from everything I've explained, you can't put a price on the peace of mind that you get by knowing exactly what the health start of your parents are. So I'll go through the pricing as we go on through the presentation. Now, to the elderly ones, what are the benefits to them? Well, again, they have access to quality medical care in the comfort of their home. Most elderly people will prefer to be at home to be looked after. It's just more convenient as opposed to having to take transport, standing in queues, all those rather avoidable challenges that can come with going from one appointment to the other. And again, they have access to a personal doctor at any time. Now, on the platform, I'll go through how that looks like. But on the platform, you have the assigned doctor and their phone number, and your beneficiary has access to that as well. So in between appointment, they can actually reach out to the doctor, to maybe to have minor complaints or whatever, and they can, get that health access, through GeroCare. Again, they have access to care without having to pay for themselves. So, you take care of that, and they have, one less thing to worry about. Sometimes they may have gifts from somebody, and they don't have to think about, do I use this money to do this test, or do I use money to buy my food? You take care of that, and they have, they don't have to worry about that part of their lives. It is important to mention that, with the regular checkups, there's an advantage of early detection and prevention of health conditions. Things that are much simpler and cheaper to deal with at the beginning as opposed to when they are sort of advanced. So I think that's a big advantage as well. And this cannot be overemphasized. So again, most of our parents, or depending on where they are and how old they are, they might be, by themselves. There's no immediate family around to talk to them. But this visit can be, the highlights of their month, or they're expecting somebody to come and see them. They know that this person has been sent by their family or their children. So that helps with their mental health as well. And of course, the reassurance that, although you might not be there physically with them, you're always thinking of them. Besides medical services, the other services that GeroCare offer, I've listed them there. So, nursing care. So if, for example, your parents need to have a nursing care service at home, GeroCare can organize that. So we currently use that for my mom. They can be living carers or someone that comes and goes. It just depends on what the needs are. So what happens is that if we request for this, they will do an assessment initially and then figure out what the needs are and what the appropriate care is going to be. So again, for rehabilitation or physiotherapy, that can be organized. Excuse me. And I've gone through the home diagnostics and medications as well. Yeah. So these are the list of the common pricing that is for GeroCare service. So the doctor on demand service, this is more like an urgent review kind of thing. So if you need someone to visit the house within 24 hours, the cost is $50, and that pricing there is US dollars. I'll explain a bit later about that, but the dollars rate is in US dollars, not Australian dollars. But so that's for the doctor on demand service. For the regular, subscription visits that are just more checkup and regular reviews, that's $30 per visit. That's for one person. If it's two people, so a couple, and there'll be a discount on that. There's also teleconsultations. Can be audio phone calls or video phone calls. $5 to $7. Again, I've not used this before personally, but talking about the age group, we're emphasizing on, they will probably value more, someone physically visiting them as opposed to talking on the phone, which is probably what you do already. But that teleconsultation can be useful in between doctor visits or for a quick, advice or whatever. So that can be used in that setting. And the caregiver services, obviously, because it depends on need and what is required, the cost in there will be individualized. So, like I said, GeroCare has been existing since 2017, and this is just a list of or been part of. Again, just a testament to the efficiency of the service and the recognition they've received. And this is the management team. So Dr. Abi is the CEO. He's a medical doctor, and also Adibola is a co-founder and is a academic doctor and has some experience with the health insurance scheme. And Bruce is the technology person. So these are the guys that founded GeroCare, and my role as the country director in Australia is to make the services known to Nigerians here in Australia. Now GeroCare has been featured on BBC, and I'll just play a video from that. I hope you can hear that.
GeroCare is actually leveraging technology to fill in the gap or to help with the failing health system in the country, especially as regards to the elderly. Well, we know in Nigeria, the health system is not as it should be, but it's even worse for the elderly because even the system that exists, as inadequate as it is, it still doesn't consider the elderly in any way. So we are trying to leverage technology to provide care for these people and make it possible for them to receive a semblance of decent healthcare. The care we provide is primary healthcare, and so GPs and medical officers are able to provide this type of care. And then they are overseen by consultants to review what they do. Once they come on board, they input their details, their medical certificates, their MDCN number. Fortunately, in Nigeria, medical service is one of the well-regulated industries whereby you can identify every single doctor. So we also have an extra layer of client services who ensures the patients are happy with their doctors.
Yes, some of you are doing very well. Blood sugar is fine. Blood pressure is fine. I'm impressed.
Our subscription is based on the fact that our visits to the elderly are not one-off. When you pay your subscription, you have access to at least one doctor visit. That doctor assigned to you is at your beck and call for the month. You have access to the platform and the reports and all those things. So for instance, you can take your mobile device and then look how mama has been for this period of time by checking their reports. So nothing really surprises you. We want to avoid the situation where you get to the house and the only solution is to take them to the hospital because you've not seen them for a while. But if you see them regularly, you catch those conditions at the earliest possible stage and manage it such that it never becomes an emergency. So though it helps their health, what it tells the parents is that though I'm in Lagos, you're in Port Harcourt, or I'm in the UK and you're in Nigeria, I still think about you. I need to ensure you're doing well. So the future for GeroCare is ensuring we're able to actually make medical home care services the first line of care across board.
Okay.
GeroCare.
Sorry, and I'll just go on to the next slide. So this is an example of a testimonial that so I received this just today. Someone that has signed up to GeroCare from Queensland, and her mom is in somewhere in Oyo State. So she says that I've tried to introduce GeroCare since I've started using the service with my mom. What a detailed and prompt service. The update is excellent. The report is also fantastic. And it's just an example of the experience that you can have by using GeroCare services to look after your parents. And this is my experience as well, and definitely speak for my family as a whole. So what I want to do next is I just want to show you the website and see, show you a few things that I think are important for you to know. But before I do that, does anyone have any questions from everything we've said so far? You can unmute yourself and ask a question, or you can type in the chat box and I can deal with it from there.
Yeah, this is speaking. Thank you, Tobi, Dr. Tobi, for the presentation. Sorry, I have something in my mind, but
yeah, the audio is not that clear. It's a bit.
Can you hear me?
I can hear you, but it's a bit muffled. Are you on the speaker or hands-free?
No, not a speaker.
Okay, go on. I'll try to make out what you're saying.
Okay, can you hear me now?
Yeah, I can hear you.
Yeah, I thought it was your presentation was smooth and yeah, straight to the point. The value can be seen there. But while I went through your website and also the links you provided, I went through the tabs. I noticed that GeroCare can only service on certain areas, while some certain areas are not explicit. Like I know in the east you cover most of Nigeria, but there's some area, but the concentration is more or less like in Lagos.
Yes.
That's where the concentration of the services is. I don't know whether it's a target market, but in other regions, very few.
I'll explain to you what that. So what you can see, I'll show that on the website. But what you can see is that some areas are normal rates and other areas are sort of added cost. So what that means is that some areas you would have, to be easier to have doctor's service because they are sort of in the area, they are local to that place. But some other places, there's no doctor that's been onboarded on GeroCare that is currently close to that area. But it does not mean that GeroCare cannot service that area. It just means that there will be an additional cost from a logistics point of view to get the doctor to that place. Okay, so it doesn't mean that the doctor cannot get there. It just means that since they're not close by, they will have to travel. So that will be added to the costing, depending on what service is required.
Okay.
Does that make sense?
Yeah, because the reason why I asked that was actually my parents are in their late 70s.
Yes.
They're working a lot. And there was a plan, they wanted to retire to the village, to the village area. But there's no one there practically.
Yeah.
relative is
Yeah.
in the city or overseas, the case may be. So I was actually trying to negotiate with my youngest sister to
Yes.
just settle them back there, maybe for 6 months. All expenses will be paid and all that. The young lady
Mm.
said no. She's not going to. She
Yeah.
feel like, "Oh, there's not going to be anyone," and that
Yeah.
she would prefer them to still be in the family house in Lagos until whatever.
Yeah.
But good, I think this service is coming up. That's why I'm asking if this can also be an option that can be packaged so that if we trial the service back in Lagos, see how effective it is,
Yes. Yes.
actually structure something that if they now choose that I want to go to my roots, I want to just relax,
Yes.
take
Yeah.
leave the Lagos city and whatever, just retire,
Yes.
and that agreement can be put in place for a doctor to be visiting them at least if once a fortnight, then to keep us abreast so that we can have that
Yeah.
information.
It's possible. It's possible. So again, it doesn't matter where your parents are.
Okay.
The only difference will be that the cost will be different if you were in Lagos compared to if you were sort of far away from the nearest
Okay.
service. So it's just been an additional cost from a logistic point of view. And
Okay.
because everything is electronic and on the one platform,
Mm.
anyone else, any other medical person coming on board will be able to see what has happened and
Okay.
take it from there.
Okay.
Says you. So I think that's not going to be a problem.
Okay. That's
Hmm. Does anyone else have any questions? Okay.
Hello, Doc.
Hello, Hakim.
Yeah, thanks
Oh
for
yeah.
the presentation once again. So it's really good that we know we have such services that we can really put up all our elderly ones to at home because I mean it has been challenging as you know. So bringing them to Australia or
Hmm.
looking for a doctor or for them being in a remote area, it's always challenge.
Yeah.
Uh,
Yes.
One question that I have is the first fee for subscription. What
Yeah.
is that meant for?
Do you mean on the presentation?
Yeah, because you said normally once you go in, you log in, you subscribe and pay a fee.
Oh no, so what happens is that after you register,
Yep.
right? Then there's a section of the website where it asks you how many visits you want to subscribe to and how often.
Okay.
Then the system will calculate what the cost is, right?
Gotcha.
Now that particular type is regular sort of visit. So, if you choose a regular visit, the visit would happen within 72 hours of your request.
Okay.
Okay. And that one for each of them is $30. Okay.
Gotcha. Yep.
But there's a separate one for more urgent review. Okay. So say you want to see, say something happened and then you just want to know what's going on
Yep.
in a shorter time frame. There's the urgent one. So that gets done within 24 hours. Okay. So that's just a one-off one.
Yeah.
Okay.
Gotcha.
Within 24 hours, and that's $50. Does that make sense?
Yeah, that makes sense. But I've not seen your website, so I can't really say much about it anyway. But you're
Okay.
saying that if I go in there now and I subscribe, so I will choose number of visits. So for
Yes.
example, I choose like, 2 visits every month, but within those months, I realize that one of the visits has to be urgent because of their health condition.
Yes. What happens? Yes. So that will be separate.
Ah, okay, I gotcha.
Yeah, that will be separate. And then the determination of frequency of visits can also be in conjunction with the doctor, because sometimes it doesn't have to be rigid.
Yeah,
Because
I got you.
sometimes, so let me give an example from my experience. So initially, we started as say every month, once a month for both of my parents. And by the time you get a sense of, what's happening, that they are stable, you might want to say, okay, skip 1 month and do it, every second month. Maybe something happens in between, and then you want, an urgent review at that time. They can use an option will be okay, so you can have you could have bought visits, multiple visits already on the platform, and then they can use one of that for one of the visits. So if it's out of schedule, okay, so it can be dynamic. It's not cast in stone in terms of frequency. So sometimes you might need every 2 weeks to visit. Sometimes you don't need that often. Does that make sense? So it can be up and down depending on what the needs are.
Yeah, gotcha. Yeah, that makes sense now. Yeah,
Yeah.
thanks.
Um. Okay.
I'm sorry. Can I ask a question?
Yes.
What about I asked this in the previous session I had with you, the phone call. What about the personal identifying information of both the sponsor and the beneficiaries? Because
Yes.
living in a security prone area, and where if you do not manage that information or there's a breach, cyber breach, and somebody accesses the details, names, addresses, who these people are,
Yeah.
and God forbid there was something. Do you have a policy in place to manage insider risk and third
So
party?
there's I'll just look through. So I've had this question of the CEO. There is a data protection um policy that GeroCare abides by, and
Hmm.
I'll just see if I can. I'm not a technical person, so I want to recall what the name of the thing is called. Um,
If you can join data
yeah,
protection regulatory agency or
yeah,
something.
it's a so the data is stored on the cloud, um,
Hmm.
and there are compliant data protection policies that you have to
Okay.
abide by. So Nigeria uses NDPR, and it's
Hmm.
similar to what's obtainable in the EU. So GDPR. So there are data protection policies that you have to abide by, and Jericho does that. In terms of the individual, um, say the doctor or the health service team, having
Hmm.
access to the information there. So again, just think about this as a hospital. If you went to a hospital or clinic, you have to share
Hmm.
your data to the people that want to provide a service to you. Okay, so and like any other health service, this the employees are bound by the confidentiality that comes with that.
Hmm.
So, there's no, and I'm going to talk about that in the FAQ. So, from a security point of view, there hasn't been any major issues since inception about, an elderly person being at risk of, being abused or used or whatever by the employees or staff that go into their house
Okay.
because you've enrolled them with GeroCare. There's not been any major issues.
Okay.
Okay, so now there's a
Yeah, so I'm just replicating what is here in Australia too. On my experience in other healthcare providers that do not present all that information, and you're just trying to manage the relationship between the beneficiaries and the service providers and all that. I just wanted to find out whether there are processes in place to manage that if it should arise.
sorry, I didn't quite catch that. Can you repeat that? Sorry.
Okay. I'm reflecting based on even in Australia here,
Mm-hmm.
when healthcare providers provide healthcare support services, there
Yes.
are legislative protective regulations in place to protect clients or beneficiaries and the providers as well, and also to
Mm.
manage complaints. Like
Yes.
when, because definitely, if my mom is going to receive the treatment and she confides in me and tells me, my son, you're trying, but I don't want this person to come again. Can they send another person or what?
Oh, definitely, definitely.
Yeah.
So there's the feedback process for that.
Mhm.
Because a doctor or whatever is assigned to a beneficiary doesn't mean that they're locked in forever. So
Okay.
there's a feedback process for that. So what happens, again, talking from experience, is that the client services touch base with the beneficiary on a regular basis. So, say every fortnight or whatever, to say, how was your appointment? How did it go? Was there any issues?
Okay.
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 So, there's opportunity for the beneficiary to relay what their concerns are direct to GeroCare.
Okay.
And you can also give feedback from your point of view as a sponsor to GeroCare as well.
Okay.
So
Okay.
if there's any
Okay.
issue with that, that can be, rearranged, like in any health service, if you don't match up with the service provider, you can always change to somebody else. So, there's no,
Okay. Okay. All right.
yeah.
Thank you. Yeah. Yeah.
There's a question from Bimisola that says that you enrolled your mom on the platform earlier in the week, but you haven't been connected to a doctor yet. Okay. Can you please reach out to me directly? So if you used I don't know if you used my referral code. If you did, I would have seen your name on the back end from I can access that whoever used my referral code. I can monitor what happens with them. But I don't remember seeing your name as one of the sponsors. If you haven't done that, just reach out to me directly and then we can sort that out. That's not a problem at all. So usually what happens is that either the client services or admin team gets in touch with you. Or if that doesn't happen, like I said, reach out to me and then I can find out what has happened in terms of assigning a doctor to your mom. Okay. I'll just go on with the demo. I'll have to stop this share and show you the page. Hold on. I can find it. Okay. Um, okay. Tell me if you can see my screen. You can see the website.
Yeah.
Okay. So that's what it looks like. So it's a gerocare.org, right? That's what the website looks like. Now, just some important things that I want to highlight. Okay, so talking about coverage area. So if you go to About Us and click on the coverage area, then you see all the states in Nigeria. You can scroll through and see whatever states. So I'll just go to any random state, let's say Osun State. And then down here you can see the locations by local government. And the rates here, what it says here, normal rates, just says that whatever I've quoted just in the presentation is what applies. But if you go down to these other locations, there's added cost, which means that GeroCare can still provide services to that area, but for logistic reasons, it will be an added cost to what the normal rates are. Okay, so that's how all the states are listed in the country. So that's for Osun State. So, I'll just choose another random state in the east, say, or let's say Abia State. Okay, so yeah, you can see again each area and what applies to that, normal rates or added costs. So just think about it like Uber, how Uber works. So the doctors are onboarded, okay, and as part of their onboard process, they put in where they're located, where they can cover. And that sort of is reflected on here as to where a GeroCare doctor is and can cover. Now, obviously that list can be dynamic because, just like anybody else, doctors move around for different reasons, travel of the country or whatever. So it may be tricky to keep up to date with, every and everyone's movement. But when you're engaged with GeroCare, they'll be able to tell you whether your location is, normal rates or added costs would apply. But, regardless of that, wherever your parents or your wards are, will be GeroCare will be able to service them. Yeah, another part of the website I want to emphasize is so here under services, you see, what's just to what I've just described as the services that are available. So home visits, Doctor on demand is also home visit, but that's more urgent. Teleconsultation, either video or audio, and caregivers. Like I said, this is either registered nurses or assistant in nursing or anything like that that requires someone to be there with them on a regular basis. GeroCare can provide that. And HMO plans. So HMO plans is more like a suit, or you pay a cost, or you choose a plan, say standard or premium or gold or whatever, and then you have a suite of services including in each plan. So remember that, like say, GeroCare has partnered with some HMOs as well. So common ones like IGEA, THT, that already provide HMO plans, but GeroCare just partners with them through that. So then some allocation of what you've paid will go to medication, some allocation will go to tests, and some allocation will go to the doctor visit. The challenge with using a HMO plan is that if you go past a particular allocation for an item, then you have to pay extra on top of that. And things like specialist care or nursing services is not covered under HMO plans. Now, this going down here, the FAQ section. So most common questions that are asked, you can find the answers here. But I want to emphasize on two things. One is the payment. So the payment gateways, there's Stripe, there's PayPal. There's a number of options of payment gateways to use. And like I said, the currency is US dollars. And a lot of people have asked me, why charging US dollars if the service is provided in Nigeria? Well, there's a couple of reasons for that. I guess the first thing is that from a business point of view, any business would prefer to hold some of their revenue in Forex if possible, just because of the fluctuation of the naira. I think that goes without saying because of the naira valuation and going up and down and stuff like that. The other thing is that in general, this is not just for Australians, but in general, diasporans have more expectation, and there's you have to go a bit extra for people outside the country to make sure that you're providing a good service. And looking at it from my experience, again, I think that is sort of reasonable in the sense that you can't just up and say you want to get on a plane and go and see your parents. And you can't do that every month. So, there's an extra value that is provided as a service to diasporans. And then that peace of mind is you can't trade that for anything. And if you think about the value that is being added to the care of your parents, I think you can't really put a price on that. So I think that sort of explains why there's a difference there, charged in dollars, and there's a difference between those that are sponsors that are based in Nigeria. So the cost of it for them will be naira, obviously, but outside of Nigeria, yeah, everyone else is charged in US dollars. I wanted to talk on security, which I've already touched on. Like I said, there's been no major incidents in the existence of GeroCare of anyone being at risk by GeroCare going to their house. Now I'll just see if I have. Give me a second. All right, and then I'll go through the registration process. So if you wanted to sign up, again, you just go there and you put in your name and your details, your email address, your phone number, and the referral code. So for the purposes of my role, there's a referral code that I encourage you to use. It's 967400. So when you use that referral code, I will get a commission, and I would there's another platform where I can track those that have registered on the service using my referral code. So I'm able to, follow up on things on your behalf if you have any questions or things like that. And then, after you put your password in, you add your beneficiary and then you choose a plan. Now, I've done like a demo account, and this is what it looks like. So when you register, this is what the dashboard looks like. So again, I've added a phantom or 2 phantom beneficiaries. So down here on the left part, you can see where you can add your beneficiaries and the added beneficiaries if you added some already. And if I click on added beneficiaries, again, I've just put a couple there, Mr. and Mrs. Australia. So you can click on each of them, and when you click on view elderly, you're able to see more information about that recipient. So down here, you can see visits and reports. You can see caregiver reports as well, if they have one. You can see test result here. So all the tests that GeroCare organizes on your behalf, the results will come up on that section, and the assigned doctor will be able to make comments on that. So sometimes, things need to be done after test results come through. Then the doctor makes a note on that, and then you know what the next steps are. If there are specialist reviews have been done, you see that on that tab. So again, the caliber of doctors providing the initial services are more medical officers. But if there's specialist care required, so we say heart specialist or geriatrician or kidney specialist and all that, GeroCare can organize for that as well. And theirs are usually just a one-off or maybe an annual review, but you get the reports, on that in that section. So again, you know exactly what has happened and what's going on with your parents. And down the profile there, you can see the assigned doctor. There'll be the name there and the phone number usually listed as there as well. So again, you have access to that if you need to contact the director contact the doctor directly. But there's also the medical services team that, again, for if you had any medical questions, in regards to your parents, you can also reach out to them and they can be of help to you. So apart from the elderly profile area, so going down here, you can see your subscriptions. So this is where if you wanted to buy a new subscription, this is where you select that. So because I've added the elderly 2 people into this demo account, I can either choose for one or the other. So let's say I choose Mr. Australia, and it then shows me what kind of visit. So if I wanted to do just for that one person, I can choose elderly home visit. If I want to do for both of them, I choose couples home visit. Now this one shows up because there's already 2 people with the same address on my profile. If it was phone consultation, you choose that and so on. So let's choose say couples visit, and down here you can choose how many visits that you want. So if it's a regular, so let's talk about the urgent one first. So say okay, let's go back to here, elderly home visit, and 1 visit, but you want it to be done urgently, right? So down here in the visit frequency section, you go and select within 24 hours, right? And then you see the $50. Okay, so that's that works for the urgent care one. And using any of these platforms, you can pay that amount. If you wanted to do the regular sort of non-urgent review within 72 hours, instead of within 24 hours, you can choose any of these frequencies. So if you say monthly, that's $30. So what happens is that after you pay, someone goes to visit that elderly person within 72 hours. If it's if you want to do, say, say want to pay for 6 visits at a time, so that becomes 1 visit every month for 6 months. But obviously, because you've paid for 6 visits in total, you can use them earlier if there's a need to. okay, or spread it out longer if you don't need to do it monthly. And the same thing applies for couple visits. You do that, and then that discount is already applied based on the fact that it's it's couple. So you just vary, what you need. And like I said, it can be as often as monthly or less often, depending on what your needs are. And while you might not be able to say exactly what, if there's been an assessment already by the doctor, you can communicate with the doctor and say, give an idea of how often the doctor thinks that it will be necessary to see your parents. So, you can work that out as time goes on. Back down here, you can see appointment. So what has been scheduled. So what can happen is that, say if you have um and the doctor has seen them today and they've already scheduled another appointment in the next month, you can see that here. So, in conjunction with the beneficiary, the doctor can say, when are you available next for me to come? And close to the time, there can be a reminder. So they can work that out, and exactly when it's happening. Then, like I said before, you always get notification when the doctor checks in and after the doctor checks out. Down here you can see prescriptions that has been requested for your elderly one. So now the other part I wanted to point out was caregiver application. So if you wanted caregivers for your parents, you can request that here, or again, you can just reach out to the client services directly, and they can talk you through what to do. So what happens is that, like I said, they would do an initial assessment. A nurse will go to the house and try to figure out what applies to them. So, whether they need, bathing or personal care, assistance with mobility, and things like that. They'll be able to figure out what services are required and tailor that for your parents. And yeah, here as well, you can always give feedbacks or complaints, as required. And then also here under my wallet, here, people you can actually fund this as there's funds there ready to go. So if you have funds there already saved in your wallet, what happens is that if, say for example, your parents called the doctor to say, or reach out to GeroCare to say that, oh, I'm feeling unwell, I want someone to come and see me. What then happens is that GeroCare contact to say, well, this is the request. Do you authorize us to use some parts of your wallet balance to fund this request? And then, after you give the authorization, they use it for that, and yeah, so that service is provided. And the last thing I want to show here is down your profile. If I can just go down there, sorry. Oh, listen, hold on a second. Someone has a question.
Yeah. Is the wallet, the fund in the wallet different from the subscription or the plans you actually pay for?
It's mainly for the subscriptions.
So the subscription that is the funds in the wallet, yeah?
Yeah, so if you don't have to put money in the wallet, you
Okay.
can just pay for the subscriptions as required,
Yeah.
right? And when say you pay for 3 visits and the
Mm-hmm.
3 visits that's being used up,
Mm-hmm.
then you can just renew your subscription, pay for more. What I'm saying with the wallet is that you can pay ahead of time. So you put
Okay.
money in the wallet ahead of time, or you have a regular, say, you have a regular amount of money towards the wallet, towards the healthcare of your parents. And sometimes you use everything, sometimes you don't use everything. Okay. So that's just, a different way of having that allocated funds ready to go if you need it. Otherwise, you can just subscribe as needed.
Okay. Okay. Oh,
Okay. Um,
Hey, doctor.
Yes, Hakim.
Yeah. So just still on the wallet balances. So
Yeah.
let's assume that I only paid for 3 visits for my parents. Is
Yes.
there like a reminder if that
Oh,
three?
yes. There is a reminder. There is a reminder. You will be. You can always check your account to see what how many visits are left. Um, or the alternative is that there will be a reminder after you've finished your subscription amount, and then they'll tell you that you don't have anything left. Do you want to renew your subscription, or do you want to buy more visits?
Yeah, because that's yeah, you know sometimes you know how it is in Australia. Sometimes you get carried away with the
Yes,
war.
yes, yeah. You'll get reminded. You get reminded. You get
Yeah, thanks, man.
yeah. Um. Does Does Remy have a question?
Yes, I do. Thank
Yes.
you, Dr.
Ask
Toby,
your
for your
question.
presentation. I was just going to ask about direct contact with the doctors. I mean, between
Yeah.
sponsors and doctors. What's the policy around that? Are we allowed as sponsors to contact the doctors directly, or do we just wait to access their, reports? If we have concerns, do we have their contacts, their mobile, and then just reach out to them?
So on the yes, you have the content. By the way, that's my wife, and she's already subscribed to her parents. But anyway, I can answer your question. So going back to the sorry, yeah, to the beneficiaries, and I'll go back to the added beneficiaries. So so when you view the elderly here, when this thing loads. Okay, so down here you see the assigned doctor, and I think because it's a demo account, that's why of course there's no assigned doctor to a demo account, but you can see the doctor's phone number. Now,
No.
do you have access to that? Yes. Now there'll be but the expectation is that people don't just call because you have access and abuse it, right? So if it's the number is there that you can use if required.
Yeah.
There's no issue with that. I do that on a regular basis. If I wanted to clarify something, I can reach out to the doctor and say, okay, what can you explain a bit more what happened here and all that. So you can do that. The other thing is that there's also the medical services team, right? That
Yeah.
can address whatever medical questions that you may have, either because for a specialist that has come in, or for other things, like say you want to organize um we've done recently ophthalmologist, you wanted to get glasses for your parents. The medical services team will organize all of that. You can have access, or you can discuss that with the medical services team, and they can clarify things for you. So the number is there if it is required. We just ask that people be sensible about that access. And I
Okay.
think that most people are. I don't think there's been any I guess abuse and overuse of that. People will only contact
Yeah.
them if required. So I think there's an issue with that.
Thank you.
The last thing I wanted to talk about on this page is the on your profile section. You also have a referral code as a sponsor. And with this one, what happens is that you get so if you tell somebody else about GeroCare and they use your referral code, they get 5% discount of their subscription, and you get 5% discount commission towards your next subscription. So just something, in addition to the services that GeroCare offers. Does anyone have any other questions regarding that? So I'll just go back to my presentation. Uh, okay. For the chorus line. Okay. Right. So I've gone through all of that. So yeah, right. So we're coming to the end of the presentation. So I just thought I should declare this obviously as a conflict of interest by me doing this for GeroCare Day. I get a commission as the country director. But you know that really is my motivation here because if you think about the actual amount and 12% commission on top of that, it's really not a reason to do this. So it cannot be just because of the numbers. But like I said, I'm a GP by training, and I see this as an extension of my training, of my service. And indirectly advocating for the care of elderly ones in Nigeria without me physically being there. So when the opportunity came, I thought it was a good. Let me clarify that my wife encouraged me to take on the opportunity, and I think it's been a good experience. And I think that when there's a good service provided by a Nigerian company servicing our community, I think it's just wise to get behind it. And I think this makes sense. We've had good experience with it as a family, and yeah, I'm happy to promote it for other Nigerians here in Australia. But it's not limited to me. You can also be a GeroCare broker. If you wanted to do that, you can just contact me and I'll take you through how that works. So essentially, you would have your own referral code as well. And anyone that uses that referral code, you will get a 10% commission on the doctor subscription fees only. So, nursing fees, medication, and all that. There's no commission on top of that, just the doctor subscription fees. You get a 10% commission for that if you're a broker, and I just get a 2% on top of that. I've touched on this already. Even if you don't want to be a broker, with being a sponsor yourself, you have your own referral code, and then if someone uses that, they get a 5% discount, and you get a 5% commission. Now, since joining the team, I've been trying to link up with Nigerian groups across the country. I've gone across most states. Well, I should say I've been a part of most groups in the country, but I still haven't been linked with any Nigerian group in Northern Territory or the ACT yet. So if you have any links to that, please let me know. I'll be grateful for that. The other thing is that GeroCare is trying to go through the Nigerian groups because you have access to a lot who at a time, and if you know someone or you're part of the executive team of one of these groups, there's the opportunity to use GeroCare for a 1 month free trial for one nominee, and just to have a first-hand experience, and then you can speak to that, based on your experience. And if we're able to enter a partnership with some of these Nigerian groups, then there will be a 10% discount to the group members as well. So that's the end of my presentation. And that's my phone number there and my email address if you need to reach out to me for any other questions that you may have. Or if you have any questions that you want to ask now, please do. Okay, in the absence of any, thank you very much for joining. This session was recorded, so I'll get the recording out to everyone that registered in the coming days,
Sorry, Dr.
and
Tobi.
I'll share it on the groups. Yes.
Sorry, I was actually trying to save some information here. What if our contacts are in the US, Canada, and UK. I don't know whether GeroCare already has contacts there, but there are also Nigerian groups, and there are also some family friends. You know, it's a connected world.
Yeah.
So if
So it doesn't matter where you know, your family groups or siblings or whatever might be. Um, in reality, though, you don't really need to have. Well, so let me go back a bit. So GeroCare is trying to get presence in US and UK and Canada as well. So
okay,
people in my capacity to publicize GeroCare service on their behalf. But
mm-hmm,
given that you now know about it, you know, they
mm-hmm,
don't have to go through that person as well. So they can
okay,
just get on the website and register and enroll as well. They
okay,
can decide to use my referral code, you know, that's
mm-hmm,
fine by me. But it
mm,
just helps, using that helps me to keep track of those sort of responsible for, so to speak, and
okay,
just keep abreast on what's happening with them. So
okay,
it doesn't matter. This can go anywhere. So I'm just
okay,
focusing on Australia because
okay.
that's my role. But you know, it doesn't matter. This can go anywhere. It can be used by anyone from US to UK or Canada or whatever.
But I think they should also increase your capacity to be Australia and New Zealand because
Say that again.
I said your capacity should be increased, not just country director for Australia or country director for Australia and New Zealand. It would be
Yes,
better.
there is somebody for New Zealand already.
Okay, all right.
Yes, yeah, yeah. Okay. Thank you very much for attending. And I hope you have a lovely evening and the rest of your weekend.
Thank you, Doctor.
Thank you.
Bye.
Bye.
Thank you.